The Normatec is a modality that utilizes the aspect of compression to treat injuries. The benefit of this modality is that you're able to treat more than one injured body part at the same time. Sometimes this modality is referred to as the recovery system or the flushing system because it helps return blood back to the heart by applying compression to the extremities. This modality is indicated when patients have swelling, a medical condition that results in poor blood return to the heart, and can be used to prevent deep vein thrombosis. Some contradictions to this modality are with patients with fractures, compartment syndrome, or poor circulation. The treatment time for this modality is 30 to 60 minutes. To set this modality up, you want to fit the patient's leg in the cuff, making sure that the foot is flat against the bottom of the cuff. You can also use stockinettes to absorb the sweating when using this modality. Next, take the hose and connect each end, one to the cuff itself and one to the modality. From here, you can press start and monitor the intensity as needed. The modality should begin to fill the cuff from the distal to proximal, pushing the swelling from the distal extremity back up to the heart. Paraffin bath is a modality that works on the method of heat transfer of conduction. Paraffin is a modality that is commonly used to treat and apply heat to the distal extremities, especially the wrist and hand. The paraffin unit is set at a temperature of 126 to 130 degrees Fahrenheit and is filled with melted wax. Indications for the treatment include chronic injuries, injuries that are in hard-to-reach areas such as the hand and fingers, and injuries associated with a loss of function. Contraindications for this treatment include anyone with open wounds, anyone who is allergic to wax, and anyone who does not deal well with changes in skin temperature or circulation in the extremities. Before completing the treatment, make sure the athlete washes his or her hands thoroughly. Once this is completed, the patient then dips the affected modality in the paraffin bath and pulls it out quickly. The patient then waits for the wax to stop dripping and continually dips the hand 6 to 10 more times. When finished, the treated area is wrapped in a plastic bag and wrapped with a towel to maintain the heat. The position is kept for up to 30 minutes. When the time is up, the wax is peeled off the treated area and returned to the paraffin bath. Cold whirlpool is a modality that uses the principle of heat transfer of convection. The advantages to using this modality are that it allows the clinician to treat a large surface area. Indications to use this modality would be if the patient is experiencing swelling, loss of function, or pain of the injured area. Contraindications would include any open wounds, underlying medical conditions, or known bacteria present. To set up this modality, make sure the drain is closed and you fill the water over the airstream. It is important to make sure the water is between 50 and 55 degrees Fahrenheit and that you turn on the airstream before the patient enters the whirlpool. So I'm going to turn it on. From here you can have the patient put their extremity in the whirlpool and continue the treatment for 15 to 20 minutes. It is also important to make sure that the patient vacates the whirlpool before turning the airstream off. This helps to reduce the chance of electrical shock.